Anthony. User
Hey,
Corey,
guys.
Dino Shark. Oh, I remember Dino Shark Lucas. I know Dino Shark Lucas is. Lucas, what's up?
I got cute sunglasses.
What do you do? Hey, did you see when
They're
I was
from Walmart.
Were they?
Isn't that amazing?
That is. Wait,
And
by the
they
way.
have matching brown ones at Ross.
Hey, Sid.
Hi, Dad.
What's going on?
I got sunglasses.
Congratulations.
And I had to buy 2 of them.
Why?
So I wouldn't lose one. And I literally, I'm not kidding you, I lost it already.
You did?
Yes, it's so sad.
Well, did you look when I cleaned out your Jeep? Did you see how many pair of sunglasses were in that bag?
No.
Oh, 15 maybe? 10 or 15?
Of mine?
I mean, they were in the Jeep. I'm assuming.
I didn't even know I owned those.
Yeah. You've got lots of sunglasses. So, hey, welcome everybody. John, what's going on? I am a licensed marriage and family therapist. This is my daughter, Sydney. She is
sitting right here.
Amazing. And tonight we have a guest who is coming on, which I'm excited about, Allie Carlson. And she is on TikTok. Oh, we can put in the comments at the Good Birth. And she is a doula and a midwife. So if you're joining, I know that she posted on her story on Instagram some questions and answers. So tonight, Sid and I will talk about relationship questions and answers as per usual, emotional immaturity. We got our favorite ADHD. And when Allie gets here, we'll talk about midwife stuff. Birth. We can talk about birth, death,
I feel
taxes.
like someone said you're not supposed to say midwife.
Oh, really?
I don't know.
Well, it's called midwifery. So maybe that's it instead of midwifery.
I don't know.
And the Joker's back. Happy Father's Day to you. Thank you very much.
Maybe it's like housewife that's like controversial, like that word.
Oh,
I don't. There's something on the tip of my tongue, but
okay.
She's an icon.
Yeah, she is. And so if you have questions about anything, parenting, I'm trying to blank on that. We'll answer those questions. But do you know the difference between a midwife and a doula?
No.
Okay, I found out, so I will wait and we'll let Allie talk about that. The Joker's back. Are you her dad? I am. Thank you very much. And Aphrodite, how do we stay up so late? We are on West Coast time, so it is only 8:00. So where are you at? Would be the real big question. But you are traveling. You're heading over to Europe in a couple of days.
How do you know I stay up so late?
You do. Have you ever had the thing where your day and night are flipped, or is that kind of a constant?
Oh yeah, no. I'm like my sleep schedule. There will always be a lot of sunlight involved in it, no matter what. That's how I can put it.
Okay. Yes.
But that's normal.
Okay. I don't even know. So when I wake up in the morning and I get up early because I want to go on a run, and then I start seeing clients early, and you're almost always awake. I mean, we're talking like 5, 6, 7 a.m. Mm-hmm. So what time do you go to bed?
Like 8. I don't know.
Okay. And then how long do you sleep?
I don't know.
You don't know. Okay.
I try to sleep for 8, but that doesn't really happen all the time.
Okay. Have you heard that the goal is 8 hours of sleep?
Exactly.
Have you always heard that?
Exactly why I said that.
Okay. Do you know so as a therapist, I've got a chance to work with a lot of clients that have had all kinds of cool jobs. I've had a couple of people that are work in the sleep arena, sleep specialists. And I was told, so I'm going to say that this is not a scientific thing right now, but I've been told that 8 hours is based off of 15 minutes of REM per hour. So a total of 2 hours of REM, which is the deep sleep. So then I don't sleep 8 hours. I maybe sleep not quite as much. So the theory would be that I would need less REM if I'm still awake and adjusted.
Have you heard that people say sleep, nobody knows why we have to sleep. We just know that we need to.
Yeah, I know what you're saying, because it is kind of odd. It's funny when you just step back sometimes and just think about all the things we do. Sometimes we're sitting there.
Look at the chat, guys.
Okay, Sid will look at the chat.
Don't be rude.
And John, I already like where you're going, and I think that's something that we can talk about when people make the conversation about them. Let me tell you what I think about that. You see what I did? That is funny, I think. I know. So in therapy, I work with a lot of people that are in relationships with emotionally immature or narcissistic individuals, and those people will often say that this person always makes it about them, and the first thing I'll do is think when I'm about to say, well, what I think that is I will always be aware that I think I'm about to make it about me. Mm-hmm. But I mean, that's what they're paying for. So that's a good thing. Yeah. Okay.
Is that why do you think people do that? Is it just not being very skilled in conversation, or is it because they're uncomfortable, so they have to instead of inquiring, maybe they're not used to people asking them questions, so they just So
I think that a lot of the reason why people do the kind of the one-upsmanship, or
I had a one-upper friend one time.
What did they do? What comes to mind?
It did not matter anything that I did, they had done.
Yeah.
better.
Or,
Like,
did they even know somebody? Oh, my dad's friend knows somebody that did. Was it that kind of a vibe?
Yeah.
So the theory behind that is that person, it does come from a place of insecurity, maybe a little immaturity, or they think that if for some reason their story isn't better than yours, then you will then say, this person is of no use to me. They must now leave. But when they tell a story that's better, it's as if they're thinking, you can stay because your story is much better than mine. Kind of silly. Like they aren't thinking that the whole time, but it's from a place of immaturity or insecurity. Okay, so
how do I stop my mind from telling me something?
Ooh,
you can't, right?
Yeah, I mean, one of the I was going to say worst things. One of the most challenging things you can do is try to stop thinking about something. We will do it right now. You do it. Don't think about an airplane. Did you do it? Okay.
Yeah, and I've been having even more of a problem with this, like, because I've been super anxious because I'm about to travel somewhere and I haven't packed. And like I can feel it. Like my intrusive thoughts are going crazy.
Okay, like in what way?
It's like with things that, it's like that OCD thing where you're like, oh, it attacks the things you love or whatever. That's so
things that
true.
are important to you. Yeah.
Like I'm gonna miss like our little dog Olive so much, and I'll literally like I'll be petting her, and then I'll just get like an intrusive thought to like throw her at the wall. Okay. And it's like, oh my gosh, that is like no my dogs baby. Have been harmed. No, exactly. Like that, like that is my baby more than if I had a baby.
Yeah, for sure.
Which is why I won't have one. Yeah. Let's make that clear. But like, I get it. Like I feel like a lot of times when you're stressed out, you try to like have, like when you're stressed, you want to have control. Like you said, like our brains want certainty.
Yep.
But like, the reality is like the only certainty we have is that we don't have certainty.
Yeah, for real. Okay, and you know how sometimes Olive will grab a toy and put it in her mouth and come up too, and we say that she's got her big feelings.
You say that.
Oh, okay, but I think, that when we are stressed and we have big feelings, that's the stuff that maybe is the intrusive thoughts come in, or somebody just gets like really upset or angry. And I still think it goes back to we don't allow ourselves to feel our feelings enough, so that when all of a sudden they're coming, here they come, they're gonna go big. And so that's where I think it'll be maybe more intrusive, or it'll be more angry or shut down or that sort of thing.
Yeah, it's like when you push things down. One of my friends, like that's like, she would tell me that's like all her family did, like all of her childhood was just like everything. They just learned to like push it down. You know, it's like that. We talk about that like with like trauma and stuff. Like when you just push it away, it gets worse.
Yeah,
kind of.
Yeah, for sure. And even, and this is where I think that even good parents at times want to calm their kid down, but by acknowledging some of their feelings. So they might say things like, hey, don't worry about it. It's not that big of a deal. But tell that to the person that is feeling it. And then they feel like, well, I guess it isn't a big deal. I think it's a big deal. So now they got to stuff their feelings and their emotions. Yeah.
Lady Poodle said, I'm having anxiety because I'm going to go watch Inside Out too.
Oh,
Don't you like that?
Okay.
Didn't you just watch that or something?
Yeah. So I have a true confession. I think I was the only therapist on the planet that had not seen Inside Out, the first one. And that was very immature of me. And you know why I didn't?
Is that all the therapist's favorite movie?
Well, yeah, because it's about your feelings and your emotions and that sort of thing. But I remember when it came out and people were having therapist watch parties and going to the theaters together, and then they were processing groups. And I didn't go because this was my immaturity. I looked up, I think it was in 2015. So that was 9 years ago. And I didn't go because everybody was saying, you need to go see this movie. So I was sitting there like, I'm good. Isn't that funny?
Yeah.
Yeah.
It's so embarrassing how we do that.
It is.
I catch myself in that. I'm like, why do I have to do that? That's so weird.
I don't know.
Because it's like by like being anti what people are telling you what to do, like you are just caring what they think.
Oh yeah. and like you're not, it was a great movie. So I showed them, right?
Yeah.
I showed them.
You showed yourself.
Yeah, exactly. Because that was such a good movie. Oh, so the question though is, what did she say though? Wait, okay. User, all the numbers, tell us your name sometimes. Psychologist in New Jersey again. Oh, right there. My name is Matt. I love joining. Keep doing you. Matt, psychologist in New Jersey. Clinical psychologist, or I would love to know what your specialty is. What kind of things do you focus on? Because as a licensed marriage and family therapist, LMFT, Matt does the real stuff. Like Matt does.
Yeah, please fact check anything that comes out of my mouth.
Yeah, please, Matt, do. Because a real clinical psychologists can do actual diagnoses, and they do all kinds of things. So I really enjoy that. So, okay, but the person said though that
they're seeing the second one.
The second one. Okay. Did you like, oh, here he goes. Okay. I'm a pediatric psychologist, but running general practice. So pediatric psychologist working with kids. So that, DM me, Matt. I would love to have you come on sometime and talk about that. I think that would be really, really interesting. It's funny, if I want to be honest, when I see pediatric psychologists, my first thing I think about is podiatry, which is like, I think, a doctor that works with feet. Mm-hmm. So my first ADHD hilarious thought was that he's a foot therapist. Go foot psychologist.
Do those exist?
No.
I'll be the first one.
They don't. Okay. All right, Matt, I would love to. Perfect. Definitely not a foot doctor.
Either okay. Allie's here or we're getting broken into.
Yeah. So we'll see right now.
Live on camera.
Yeah.
If she comes, I think I'll scoot.
Okay. Right, okay. And here's one. Okay. And this, that Lena, maybe we should jump in there too. My parents never acknowledged my feelings or reciprocate anything. And I think that part, Lena, is what I was talking about earlier when people, parents need to stop and take time to be curious about their kids' experiences and their emotions. And so I think that as a kid, we are trying to express ourselves because we're just being kids. And then if it makes the parent uncomfortable, that's when the parent will say things like, yeah, don't worry about it. Not a big deal. Not right now. I'm busy. And it just teaches a kid that their emotions aren't very important. And so, yeah. Oh, and Lena said the same. Yeah. Or no, Jordan's saying that. It has the same thing.
Someone asked where we are. We came out of the closet.
Oh yeah,
and we are in the living room.
Ladies and gentlemen, put your hands together.
Oh no.
Allison Carlson.
Wait, I'll take yours.
Okay. Oh, no, welcome aboard. No, come on in. So we got us live over here on YouTube where there's one person. Nobody ever looks at that one.
No, wait,
and then over here,
we
got a few thousand on TikTok.
I've only ever been late to this.
Oh, yeah. Amazing. I'm so glad.
Okay. So, so you are a midwife?
Yes.
And a doula?
Yeah.
Okay. And then we know the difference with you.
Yes, I do know the difference.
Okay, yeah, no, Sid and I totally do. We'll probably let you explain it though.
Yeah.
Okay.
A doula is a non-medical support person for childbirth. So they're your advocate. They're like, if this is an example, but if the doctor's like, hey, we got to give you a C-section right now, then your doula will be there and say, here are the pros and cons to this happening.
Okay.
Here's the evidence behind it and give you the choice basically.
How many people do that? Like, cause the doctors, I mean, and this is what I was excited to talk to you about, because if somebody's in that position, are they almost terrified to go against what the doctor might say?
Well, that's kind of the doula's role, is to show them that can happen, that doctors sometimes use that fear-based tactic.
Mm-hmm.
And of course, a mother's going to be scared for their child and want to do what's best for their child. But that's where the prep work comes before the birth.
Okay.
So then they go in and they usually are confident and they'll just be like, I understand what you're saying. To the doctor, they might say, I understand what you're saying. You want this and this because of this and this. But the evidence I've seen or learned shows the XYZ. So I decided to decline XYZ.
Okay.
And then at that point, like, it is their right to do so. So the doctor might be upset, hopefully is super supportive and just says like, this is up to you. And then we'll give other options, but it kind of depends on the situation.
Okay, totally, right? So
that's a doula.
And so if people have questions tonight too, I would love to know if there's anybody that...
I have a question.
Yeah, okay.
And I'll look at your guys' questions too.
Okay.
Why do you think that they use, like, you said, like, doctors use fear-based tactics?
Some of them.
I feel like, I mean, I've never given birth, but I feel like I've, like, kind of experienced that.
Oh, yeah?
Before.
The fear-based?
Yeah.
Yeah, you've had a couple of bad experiences,
Yeah,
right?
and I just want, like, why do you think that I mean, either of you, like, why do you think that is that they do that?
Thoughts?
You start with your thoughts.
Okay.
I have my own thoughts.
Okay, so I mean, I do a lot of things where I'm still kind of operating from a place of where I'm going to give people the benefit of a doubt, assuming good intentions. And so a lot of times a doctor, and I've actually had a lot of doctors as clients, and I know that one of the things that is frustrating for them is when and I can understand this, where if they do know that it's funny now with you here, it's like, if I'm saying they do know that something needs to happen, but maybe there are certain situations where they feel confident that this is something that the patient doesn't understand or doesn't know.
Yeah.
And I'm not thinking about in the birth area. I can't lie, right?
That's okay.
But then it's like, and a doctor, and this isn't a great answer, but if they only have a limited amount of time and then they really want to, I don't know, maybe they're overwhelmed, maybe they're stressed. And so fear, unfortunately, is the thing that will often drive behavior change, but it's not the best way to build a relationship or make somebody change internally. So somebody might scare somebody into doing something and they'll do it. It's like TV commercials back in the old days would do a lot of fear-based things.
I feel like religion sometimes
for sure
that.
Yeah.
That was actually one of the questions I got.
Was it? Okay, we'll talk about that. Yeah. Okay, but so what do you think about that?
I mean, I really do think I think for the most part, doctors, midwives, whoever, because it can happen with midwives
Therapists
too.
as well.
Yeah, anyone can use tactics that probably shouldn't be used. But I really do think that for the most part, they have the best intentions. I think they truly believe that what they're saying is the right way.
Yeah.
But I don't think that a lot of them respond to people choosing for themselves very well.
Yeah.
And I've seen that firsthand as a doula and as a midwife. Like when we, as a midwife, sometimes like probably about once a year, we have to transfer a client as an emergency.
And what does that mean? Transferred to?
Yes.
And so we stopped with doulas versus
Yeah,
there to
touch on
advocate,
that.
and then midwife.
Let me touch on that first.
Okay.
So as a midwife, I am a medical professional for childbirth. So it's equivalent to an OB only in the fact that you would choose either an OB or a midwife. You don't need to do both. I only do home birth or birth center, and I work primarily in Utah. So when we're there, I have my clients that I catch their baby, or technically I have my clients catch their own baby, but that's what we
catch
say.
the baby though. I know, like literally.
Yeah.
I mean, that's like a phrase, but I like that phrase.
Yes, but it's an actual phrase.
Okay.
Except for we say that like, oh, I catch babies, but I rarely catch the baby. Usually we have the dad catch the baby.
Okay. Like
so we're just there.
In
so
my head, it's like shooting out. Like,
I know.
And they have a minute.
Like,
yeah, come on. No.
Basically. Okay. No, but so as a midwife, every once in a while we'll have to transfer a client, whether it's for an epidural, just because they want one, to the hospital, or if there's an emergency, we will transfer with them. And so we get to work with doctors, and most of them are pretty defensive. Like, and right when we walk in, they're just like, oh my gosh. And we're like, we see you once a year, dude. Like, just chill out. And so
we come in peace.
Yes, we come in peace. And also we want it to go smoothly because it's the safest.
Oh, gosh, yeah.
And so we just had a transfer recently that was only for an epidural. There was nothing going wrong. And when they got there, they started talking about C-section to this mom. And we were like, she wants an epidural. Like,
which
what are you talking about?
For the kids at home, like an epidural is numbing the patient.
It's so that they don't feel like the pain of childbirth.
Yeah.
And so not most of my clients don't even think about wanting an epidural. Like we don't offer that in home birth or birth center. But every once in a while, when a mom has been laboring for days, they opt for an epidural. Right? Yeah, and that's totally fine. So that way we would transfer over with
I would
the mom.
get one on the way there.
Sid wants to start one right now.
Yes, and that's fine, but it does make you higher risk. So that's why we don't do it out of hospital. So we would transfer them. And recently we just did this. We transferred a mom for an epidural, like I was saying. And when we got there, there was a hospital midwife. Some people call them midwives, just because they're more like a doctor than they are a midwife. Okay. But the name is intriguing. Everyone's like, oh, I'll have a hospital midwife, and I'm still having a midwife. But they're very like a doctor in most cases.
Okay.
So we transferred. This midwife came in, this hospital midwife, and me and my partner, we're both midwives, we're saying, yes, we're the providers for this client. She just wants an epidural, blah, blah, blah. She starts talking about a C-section because of one of the dips of the baby's heart rate. And me and my coworker are like, no, like this baby's totally fine. She wants an epidural. Like that's all she wants. So it became this like standoff of us telling our client, this is up to you. Don't be afraid, but it's up to you. This is what's happening. These are your pros, cons, whatever. And then the medical director comes in, and he's
of the hospital,
super charmed of all the hospitals.
Oh, wow.
Yeah. Of all the I shouldn't say the exact hospital, but of all the hospitals in the area.
Yeah.
And he's super charming, and he's just like,
McDreamy.
Yes, basically. Literally, we were all like, I looked at the client and I said, don't let his eyes get to you. Don't do it.
Look at the nose.
Yes. But anyways, he was so sweet, but he was so sweet. And so I was like, all right. And he says, look, I'm not the cutting doctor. I do not like to cut the clients open. This is up to you. We want you to have vaginal birth, blah, 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 which was great, but it was still a little bit fear-mongering. So we had to really find the balance of that is what I'm getting at. So I think it's important to figure out if things are fear-based or not.
Yeah.
And the evidence behind them is all. So yeah, there's a lot to it.
But I like what you're saying though, that's something you need to maybe prepare for ahead of time, because in that moment when you've got the adrenaline flowing,
you're scared for sure. Like if you think about your oxytocin level, which is the love hormone,
cuddle
or
hormone.
What makes you feel good. In a home birth, that's why I love home births, because the oxytocin is so high. We feel comfortable at home for the most part. You usually have your loved ones around, your husband or your partner or whoever. And then you have to transfer to a hospital or you have to drive to the hospital if you're planning on a hospital birth. And you're already like, okay, this sucks. I'm in pain, like in the car. This is so bad. Your oxytocin is just going like this.
Oh,
and
so there's no cuddling at that point.
No, not so much.
Okay.
Then you get to the hospital, bright lights. You're having to fill out paperwork. You see all these strangers that you don't know.
It
like
smells
strangers.
weird.
Yeah, it smells weird. They start poking you. Like, can you imagine your oxytocin was here and now it's just like plummeting?
Now we're in the world of cortisol and stress hormone, and we're starting to get into fight or flight. And,
exactly. So then people stop being more intuitive and instinctual, and they start going to cortisol and fight or flight and what you're saying, just like whatever, like I can't do this. I want the epidural now. I don't care. Like they're freaking out.
Wow.
And so as a doula and a midwife's job, our job is to keep that oxytocin high and help the client get back into a grounded mode.
Yeah.
So that they can make decisions that are not fear-based.
Okay. Yeah.
or
then, okay.
stress-based.
What are what's the training that it takes to get to become a midwife or a doula?
Yeah. So the doula one is just like 3 days or something like that.
Okay.
That's non-medical. So they don't do anything medical. They're there to be like, you're doing so good kind of thing. And then they know they need the education part of it in about 3 days. Then they always stay up to date on current studies and stuff. And then the midwife, it depends on which route you want to go. You could be a nurse midwife, DEM, LDEM, depending on what you want to do. But basically mine was all hands on from day one.
Okay.
So you literally my first day, you get thrown into a birth and you start as the observer.
Okay.
Then you do however many births, 1 million births. And then you go to the assistant. So you're handing them stuff, you're drawing up meds, those kind of things. And then the third, you are the primary midwife, but you're under supervision.
Wow.
And you do a bunch of births there. And then you have to pass off like 2,000 skills or something. Don't quote me on that. With competency. And then you have to do births all on your own with your observer there, or your teacher there, but they won't say anything.
Okay.
Yeah.
Wow.
So then you have to pass the NARM if you want to go that route, which is a national exam. So
was that a hard exam?
I haven't taken it yet.
Oh, okay.
I don't know if I ever want to.
Gotcha.
Yeah.
Okay.
But that's a whole nother story.
Yeah.
That's all politics. So.
Okay. I saw somebody on there say that they I think they said two. I now don't want to get banned by TikTok.
Oh, you're
I
cussing
no, they said 2 births one way and 1 C-section, and then they said epidural all the way.
That's totally fine. I'm not anti-epidural, just so you know.
Yeah, and then and Devin, any insight on why an epidural sometimes seems to cause a baby to decel?
Yeah, so if you think of if you step back and think of how birth, I shouldn't say should, how physiological birth is, drugs are not involved. So then think of it as a drug. Like I said earlier, once you get an epidural or Pitocin or anything like that, side effect, you become higher risk. So an epidural can oftentimes depress baby. And that's why then they go, oh, now we need to give you Pitocin because the baby's heart rate's low. Yeah. So now we need to get you going and it will raise baby's heart rate. Or sometimes they give you Pitocin, it raises baby's heart rate. So then they give you an epidural and then it lowers baby's heart rate. So what we always talk about, which is evidence-based, is called the cascade of interventions. So the second you leave your house.
It's also one of the Harry Potter books.
Is it really?
No, it sounds like, right?
It's actually funny. Side note, me and my coworker always talk about how some of the words we say sound like a Harry Potter spell.
Oh, then I was okay.
Yes, we always say
the cascade of interventions.
Yes,
right?
and like malodorous lochia. That's literally a medical term that we say, and it sounds.
You throw a wand in your hand, and something's happening at that point, right?
Yes.
Yeah. Okay.
But
cascade of interventions.
Yes, cascade of interventions. So the second you leave your house, you are now plummeting your oxytocin, which we talked about, and that is beginning your cascade of interventions. So when your oxytocin's plummeting, you're now going to start asking for the epidural. You're now going to start going, I don't think I can do this anymore. I need the epidural, freaking out, whatever. So then you get the epidural. Let's say you can go in, you get the epidural, but then they go, okay, but we need to get an IV in you first. So then you're getting an IV in you and you're like, I'm just not comfortable. And you're freaking out, whatever. So now you have an IV, an epidural. And then once you have the epidural, you can't move around very much because you're numb.
Oh, okay.
So then you're laying like this and your pelvis, sometimes you can switch side to side. Still not much. And then your pelvis is now narrowed because of the space.
Wow.
So then they're like, oh, it's taking a while. Of course, your baby's head can't descend.
Yeah.
So they go, it's taking a while. We need Pitocin now. So then you get Pitocin. And then they're going, oh, okay, baby's heart rate's a little bit high. So now we need to do whatever. This is all an example, but now baby's lower, but the heart rate's high. So now we need to do some forceps to get the baby out. And you're going, dang it, I don't want forceps. Okay, well,
forceps are literally vacuum. Like tongs, right?
Yes, they're literally tongs that they kind of go around the baby's head and pull the baby's head out. Oh my God. Yeah. And then, so let's say they do forceps. Forceps then requires an episiotomy most of the time, which is cutting the perineum. Yep. We won't get too far into it, but yes. So now you have what all you wanted was an epidural, and it ends up with episiotomy, sometimes a C-section, and then you're left with trauma because you chose one thing and it led to
and now
15
that's
other things that
I would say as a therapist, when I work with sometimes people with postpartum, I mean, there's the one concept where people just don't know what to anticipate, and they wanted everything to go perfect and after the baby's born and stuff. But also there's the one where I'm going to have this type of birth, and then it doesn't happen that way, and they feel like they did something wrong.
Yes, of course. And it's not, it's not their fault.
Hey, can you answer this real quick here, Ellie? I like this. Chandler says, I feel a lot of doctors have been inducing women earlier instead of waiting until the EDD. And she said, I'm due in 3 weeks.
You guys, I have some words about this. Before I'm going to answer that, I was going to say something important that I like when clients know is that you can't control your birth experience. But you can influence it.
Okay.
And that's what they're like, I'm not going to make a birth plan because it doesn't ever go how you want it to. Mm-hmm. But then they don't prep, they don't read books, they don't do anything. And I'm like, you are for sure influencing it at this moment by not doing that.
Yeah.
And it's important to know that it might go south, but even if you transferred to the hospital from a home birth or something, you still would go knowing I get to choose what's happening.
Yeah.
You could still go knowing, and knowing like, okay, this is the next safest place for me. And that's okay. And it's because they feel in charge and they feel in control of their body.
Yeah.
There was actually a study done, and then I'll answer hers, that talked about why women were having traumatic births. They figured out that there were 3 things. One was how the people who had traumatic births reported that they were not treated well by professionals and people around them. 2, they were not in charge. Like they didn't feel in control, whether that's of their own body or
just the scenario in general.
Anything. They felt out of control. And then the third one was, I can't remember, but it's just really telling. Those 2 alone are really telling how the people around you, how they treat you. If a doctor's upset with you, whatever, that's going to make you feel small. Or anyone, even your mother-in-law, whoever comes. Yeah. And then the second is not being in charge. Mm-hmm. And so I think it's important to prep for it just to influence it. But then speaking of, sorry, I'm talking a lot.
That's what we get to hear. We talk all the time. Yeah.
I'm loving this.
So to answer about due dates, it's actually very interesting. This is probably going to make a lot of people mad, but I'll try and be cordial.
Okay. You do you.
So we actually go, so there's what most people go off of. The due date is 40 weeks.
All right. Okay.
And we don't do that. We will note that, like we'll be like, okay, 40 weeks, here's your due date.
Okay.
But then we put in what's called the Woods method. If you look up the Woods method, and it will tell you how to do it. It's like a year forward from the first day of your last period, whatever, all this stuff. Then 2 months back, and then minus 14-ish days, depending on how long your cycle is.
So is that going to be longer than 40?
Much longer than 40.
Oh, wow.
So if I went back on my daughter, I induced myself naturally, whatever, with castor oil with my daughter. Oh. Don't recommend it. Ask your doctor, blah, blah, blah. At 41 weeks and 1 day because of a bunch of things, but it doesn't matter. Then I went back now, like the past few months, I went back and looked at what her real due date would have been. And it was like 2 days later.
Wow.
That I would have gone into labor.
Wow. Okay.
So
why do we pick 40? Do you know?
Well, there's a lot of different reasons that they could say, but they say that the stillbirth rate does go up, which it's by, I could be off by like a point number, but it's like 0.07%. And then the next week it's like 0.0 or 0.14, 0.014. Wow. Go look it up.
0.14.
Yeah. If you look up on evidence-based birth, they have it really written out for you, which I think is really cool. But really, if you think of a doctor that says your stillbirth rate goes up a lot by 40 to 41 weeks, they go, oh my gosh.
Want to take
then they say this, and it doubles the next week. And you're like, oh my gosh,
so
for
some
sure.
People are thinking half the babies.
Yeah, they're thinking tons.
Yeah.
But then if they give you the absolute risk, they're saying, okay, it's 0.07 to 0.14.
Okay.
And you're like, Yeah. So that's much different than saying it doubles.
Yeah.
That's a relative risk versus the absolute risk, which is 0.07.
Okay.
Why are they doing that? Like, do they get money if they? Okay.
I mean, that's my super controversial opinion.
I mean, that was
that money.
That was immediately what I thought, honestly.
Yeah.
So,
I mean, think of
these.
I know that's super controversial, but think of how much they're taking in like every time they do something. Also think of schedules. Like doctors don't want to be on call when they have like something coming up.
Yeah.
So if you look at the rates of the most born babies, it's actually 9 to 5 or 9 to 6. And then in home births, it's like 1 a.m. to
really?
7 a.m.
Okay.
I think I might be an hour off, but that's really interesting.
Yeah,
Totally. It's just very odd.
Yeah.
That's all.
Okay. Other questions? Did we miss any of those that were happening while we were talking as well?
Well, I can scroll up and see.
Yeah, do. Okay.
So you're spilling the tea.
Okay.
I know I'm scared people are mad.
No one's mad. Everyone loves you. Seriously.
Well, and but I feel for like Miley. I mean, I really appreciate. I'm so sorry too because I know that's.
Yes, it is
hard.
So sad. It is so hard when that happens, and of course we feel for those people. And I do wonder like if people were to sometimes would it save certain babies? And yes, it would. The evidence is kind of sticky because they show like you'd have to induce so many people at 39 weeks to save a few. Yeah. And of course we would think, oh, that's worth it. Like if that happened to me, I'd be like, that's worth it. But it's also sticky where inducing also leads to C-sections, and C-sections is a higher death rate for mother and baby. So it's very sticky, and I totally feel for people that have been through stillbirth or maternal death or anything like that. Yeah. The whole thing is very controversial.
I can imagine. And here we've got Adriana had him at 42 weeks.
That's awesome.
This one, right? Yeah. And I see Shannon Felt, my friend Shannon's here. She's pregnant right now.
Oh, that's awesome.
Yeah. And so, I think, okay, other so other questions. And you asked for some questions on your Instagram, right? Yeah.
Yes. Let me look them up.
Okay,
actually,
sounds good. Okay.
Because I have a bad memory.
Okay. Little Mama's, hey, I have questions. Let's hear them. That'd be great.
I heard someone asking if you can get an epidural at home.
No, you can't. Once you get an epidural, you're higher risk. So.
How long does an epidural last?
Oh, it depends. You can keep it going. You can press a little button. It just keeps going. Yeah.
Dang. Okay.
And so.
Why you want one?
No, good. Okay. Somebody said, "Oh, this is Dr. Matt. FYI, there are also some new data that correlate full-term births with decreased postpartum."
Yeah, postpartum depression.
Yeah. He's a psychologist. Yeah.
So cool.
Okay. Why would somebody willingly go through childbirth?
Oxytocin and endorphins are really there to help you. Yeah. People think of childbirth as like this crazy, terrible, scary thing. But if you think of people who love childbirth, like if I go up to someone and they're telling me I hated unmedicated, it was the worst thing ever. Like I usually would say, "Oh my gosh, did you plan to go unmedicated?" And they're like, "No, my epidural didn't work." Yeah. And I'm like, "Oh, okay." Or they might say, "No, I didn't. It was too fast. Like that I didn't get my epidural." Yeah. And then the other thing I sometimes will ask, if I'm being cheekier, is, "Did you have a doula?" And they're like, "No, I didn't." And I'm like, "Okay." Because the people who love childbirth are usually the ones that tried to prep for it and they got in a different mental
headspace. Do you know who loved childbirth?
Who?
My wife. Your
no way.
Mom, Wendy.
That's awesome.
Four natural, and she's like,
she's awesome.
She's like, she's never felt more alive. That sort of thing.
And it's because you also have all the endorphins and oxytocin to help you through it. So it's just like a high when you give birth.
I like how he talks about it being like intuitive.
Yeah.
Too. And like if that makes sense, because I guess we are just kind of like animals.
No, seriously, we go off that a lot.
I love that.
And if you think of animals doing it, mammals, if they're being chased by like a tiger, they won't have a baby. They'll literally close up and be like, no. So we're similar in the fact that if we don't feel safe, we're not going to dilate. We're not going to have a baby very easily. And then the other thing that you were saying about the intuitive stuff, it's actually so fascinating, you guys. I wish that someone would just be willing to give birth right here for you guys physiologically, but that would go against physiological birth. But what would happen is like oftentimes we see a mom that will like feel like she needs to put a leg up And usually that baby comes out asynclitic or crooked.
Oh.
And it's showing that like she knew, her body knew.
Oh, gotcha.
So her body's trying to put up a leg so that her hips can turn the baby.
Uh-huh.
And then the baby comes out with like a little side cone head. And we're like, oh my gosh, that's why. Like,
can you do anything about that?
They do it. They do it themselves.
Oh, I see. Okay.
Yeah. So then, or
And
a
she doesn't
posterior
know
baby.
where it is at that point.
No,
That's
she doesn't.
so good.
Like a posterior baby is facing the opposite way. Okay, that's all you need to know about it right now if you don't know. And oftentimes, if a mom leans forward like this, they're trying to flip the baby to the right way.
Whoa.
And so the back is back here, so the baby's facing this way.
Wild.
And the mom will start going like this in labor, and the back swings forward to the front, and then they're in the right position. And so if a mom does that, I go, are they posterior? Is that baby posterior? And then we watch and we trust that the mom's intuition is intact, and we just really support that, and then the baby comes out.
Okay.
And so it's really cool.
Here's the question, little mamas, and then and Shannon's the most amazing high ever, the most intense and insane, amazing experience, right? Yeah.
Oh, Shannon felt
yeah,
it was awesome.
Right. And then, okay, and little mama, I had a placenta eruption that can cause anything. Can that cause anything wrong, medically wrong with my baby when he gets older?
I'm assuming they mean an abruption. It really depends. Like, usually no if they caught it in time, but it really depends on like, I would have to have been there to know like at what degree it was. But if they caught it in time and everything was fine, then you should be good.
Okay. And there's one, I would love your opinion here, Graham. I'm worried about my wife's postpartum depression may get worse if we have another. Any thoughts?
I would definitely recommend not even necessarily just therapy, but what is it called? Like a specific place that's for postpartum. Is there a word for that?
Is like an inpatient or no?
No,
it's
not inpatient. I don't know. I know we have one in Utah.
Okay.
And it's specific to
postpartum
depression.
Do you find that I often wonder, having worked with people that have postpartum depression, how much of that could be a hormonal imbalance?
Yeah, it could totally be that. It could be what they're eating, with like those nutrients they're lacking. If they're doing DHA, like, which again, talk to your doctor. Trace minerals, electrolyte, like all of that stuff actually does cause a huge difference. Mm-hmm. They could do supportive herbs, which I can't talk about much. But those kind of things really do make a huge difference.
Yeah.
We usually will go towards herbs first, as long as they're already eating well. If they're not eating well, then we're like, whoa, let's start there. Because if you're eating like Twinkies and not drinking water, I'm like, what's supporting your brain right now? Then we'd go to that. And then of course we have that with therapy, with support, having a support system is huge. If they're just like doing this all on their own, it's like, no wonder you have depression, or anything, anxiety, or any of that stuff. So
and that would feel alone. And when we got the concept of like we all have this ability to express our genes will express a certain way. We have a genetic predisposition for anxiety or depression. And then if you have support around you and you are eating well and you are meditating and then those genes may not express themselves in that way. But then I can't imagine the stress of pregnancy and then if you do feel like you don't have people there for you, I think that would be a lot.
Yeah, it's so tough.
How we truly are animals. That is so true. Okay.
Chandler said, I struggled with depression, anxiety, and bipolar beforehand, so I'm worried about the postpartum. Do you think that could like increase?
Yeah, it does increase the risk.
But what I like, so I like though that I appreciate Chandler being aware of it, because that's where I think that if somebody, it kind of goes back to what you were saying about having a birth plan. I think that if somebody is aware, then that is something that they can start to look at and
influence.
I
think
love
so.
That. I really do.
I think so too. Yeah. I feel like once clients say that, I'm like, that's good to know. Let's get going on it now.
Yeah.
And so that's a great point.
Yeah. I used to, and not trying to be controversial at all, but when there was a book that came out a long time ago called The Secret, and it's all about like manifesting.
I love The Secret.
So when it came out though, I was in this place where I had some clients come in and one of them had said something like, it's super crowded at the mall. It's Christmas. I'm manifesting me a parking spot. And so, so that was, I'm kind of like, okay. But I like the fact though, where I think it's so important is that if somebody is just becoming aware of something and they are allowing themselves to think about it and dream, then there's a better chance it could happen than if you aren't allowing yourself to think about it.
Right. Yeah. I agree.
Yeah.
I think it's cool.
It's just putting you in a happier mindset. I feel like your life, life is more fun that way. Simply, it's more peaceful and things just seem better when you're, because like you said, like we were talking about like the Inside Out movie earlier before you came. It was like that, like everything is just like your perception of it, right?
Man.
Like you can,
That's so cool.
you can make like a sad moment happy or a happy moment.
Well,
sad.
so you know what's funny is that I was admitting that I think I was the last therapist to ever see the first Inside Out I saw yesterday.
Oh yeah.
Yeah, and
that's crazy.
And I know. I was very mature. Everybody back in 2015 was saying you have to watch it. So
you were
my immature
no.
like I do not have to watch it. But right out of the gate, they show what Sid and I talk about on the TikTok lives a lot of how we influence memory and sadness. They had one of these memories and sadness touched it, and then they're like, "Oh no, you're making that memory sad." And we talk about that. The mechanisms of memory are fascinating. Of
that
where
really
if we because we're having a thought and then we pack it in with all the emotions and feelings that we're having. And I have to imagine that is a big part of even about pregnancy or getting excited about birth, or am I worried about birth, or am I
that's such
so
a cool
right
thought.
So I wonder how much of that then impacts the mechanisms of putting that memory together,
right?
Yeah, and
that's
keep it
so
away from sadness, right? I saw the movie. Yeah. Okay. Is there a risk of okay, here we go.
Is there a risk of that becoming worse if we had a third? Is that what you're reading?
Yeah, but did I miss
postpartum?
Okay. I don't.
If you have like a second part to that question.
Oh wait, here we go. Here it is. I'm thinking she's a doula. They haven't answered any credentials.
Oh, sorry.
We actually, we did at the beginning. So,
I'm a midwife primarily, and then sometimes I do doula work.
Yeah.
I like to do midwifery for many reasons and doula work for others. So I still do them both, but I do. Most of my clients are midwifery clients or midwife clients.
Why is it midwifery?
I'm so sorry. It is.
Okay, I don't think every time I hear doula, I think medulla oblongata, something in the brain, and every time I hear midwifery, I think midwifery.
That's fine. Whatever. It's like potato.
I know that's like the same thing in my head, right?
Yeah. But, yeah, I feel like people that are midwives call it midwifery.
Okay. Well, they do. No. I have a client. I'm so enjoying, and she talks about being
midwifery.
Midwifery.
Oh,
yeah,
that's awesome.
So okay, I've never heard that term. Yeah, goofy swoop. I know, right? Okay, so should we get to some of the questions that you have?
Oh yes. Okay.
Yeah, and how long do we have you tonight? Because we've already gone 45. Good. Okay.
That was so fast.
I know, right?
Okay, this one I thought was really. Actually, one is really controversial. How?
Let me see.
How am I allowed to talk
about? You can talk about anything you want.
Okay.
Yeah. Do you want to save that one for a little warm up, or do you want to get?
Should I do other ones?
Yeah,
first?
Yeah, sure.
Okay. So one of them is how do you know when you're ready to start seeking new connections after divorce?
Okay. Do you have thoughts?
I don't. No,
okay.
You go.
Okay, so
this is
yeah. So I have a lot of thoughts on this one. And first of all, there's a concept of after divorce where people will say, okay, you need to wait 6 months, you need to wait a year. And I understand that. But then as a therapist now for almost 20 years and working with thousands of people, that people often when they're coming out of divorce, especially if they were the one that woke up to the emotional immaturity or the narcissistic traits and tendencies of a partner, they're coming out of almost maybe like a trauma bond. And so they often don't feel very good about themselves. And so the difficult part is that they're in a position now where they want validation so bad, they might find themselves in a similar situation. So ideally you want to say, take that year. But if that year you're
not doing any work.
So if you're going and like becoming a yogi meditative guru and learning a language and helping out at a pet rescue shelter and in eating right. Oh, that's exactly. Then I say, man, that year you're going to raise your emotional baseline, and when you jump back into the dating world, you're going to hit it at a completely different place. But what I find in working with people is they become, and it's part of this concept called pathological loneliness, where that loneliness is like an ache. It's this deep ache within. And the only way to alleviate it is to now go interact with somebody. So people will jump on dating apps and then they want validation.
Right.
And even when I'm working with clients, they will admit that they're looking for validation. But then, you'll still find them thinking, no, but I don't know. This guy does seem like this might be real. But then they're often repeating similar patterns of what they got out of. Yeah.
So then if someone is, I'm only asking a follow-up just because I know the person, but if it wasn't her fault.
Oh, yeah. Yeah.
And like her husband was just some stupid idiot. Would it be fine if she just jumped right back in?
Well, so it's.
Is it still?
So here's the part, I always like where even 10 years ago as a therapist, I would say, no, she still needs to go do her work or whatever. But then I've worked with enough people that the human experience is we want connection, especially if we come out of a relationship and almost feel like we got duped or this person wasn't who I thought. This was not the relationship I was looking for.
They're still going to have some sort of
So that can be a difficult thing because we crave validation so bad. And if somebody was in an unhealthy relationship, then they were most likely almost probably begging this person for validation of saying,
that makes sense.
You need to care about me. And so then if they're going into a new relationship, they're more apt to find the person that is going to love bomb them or is going to show up. And it's like, you're the greatest thing ever. And that's going to feel amazing. But then, and the hard part is if I'm working with somebody in that situation, I talk about, I want them to introduce what I call positive tension. So let's say that they say, I like this food. And the other person's like, oh my gosh, that's my favorite food too. Then that's going to feel amazing. And we're going to get the dopamine dump and oxytocin and stuff. But I want them to say, well, tell me what your favorite way to prepare it is, or tell me, like, go in there and dig a little deeper, because often the person's going to respond on a surface level just because they want to say the thing that will get, this girl to feel good about herself so that I feel good about me.
Yeah.
And then
connection.
Yeah, exactly. Yeah. But it really is just validation. And people want, they want intimacy. They say they want intimacy, but I think most people are just looking for validation.
Okay.
Yeah.
Yeah, that makes sense.
Yeah.
I feel like if the guy was the douchebag and like you have
to,
I don't know, and you have to move on from that. And I feel like that is because of like the harm that they may have inflicted on you. That's when it's especially important to take like a year or more just to like find out who you are again. Because like
you've done that, right?
I'm on year 4 and I'm ready to go till I'm 30. It's amazing. Seriously though, I love being single. I had no idea. I was jumping from relationship to relationship. I went from this one guy who turned out to be gay. Sorry.
He is a great guy.
He's a great guy.
He's fun.
That's fine.
Yeah,
no, it's amazing, but it was a little confusing for me at the time.
Yeah, it's like, I'm gonna try guys.
That's what they say. No, love you. But I went straight from that relationship straight to this other guy, and then I went like straight from that one to like it was like I never knew who I was, not once.
Right.
I was just like trying to find myself through these guys, and I needed to be alone. I feel like
I was like that in high school too. I feel like I don't think I had more than a week between guys in high school, and then luckily I ended up with a great one. But yeah, you have to seek that validation if you don't have tools otherwise, like to go somewhere otherwise.
I mean, ideally, because that time that you're on your own, you're hoping to learn to self-validate.
Right.
Yeah, and learn to find the things that you enjoy and not doing it so that someone will say, oh my gosh, you do that so well.
Yeah.
But it's
totally.
It's like, oh, I know I do that well. That kind of thing.
Yeah. You're like, I don't care what you say.
There's another thing that is interesting too, though, that you'll find a lot of people when they get out of a relationship, they'll go right into one that has whatever they were missing. So if there was, I've worked with people where if their partner didn't ever wanted to sit down and talk about things, then they might go into a relationship where that's all this person wants to do. Or if there was a relationship where there lacked intimacy, then they would jump right into one. And so sometimes they would look so much at that, what they were missing, but then they'll ignore all the other stuff.
Yeah, that makes a lot of sense.
Yeah. So
it's so crazy that our minds do that. They're just like, we need to find that anywhere. Like it's really sad, unfortunately, but really cool.
It's like we're just like filling a void that we don't even know we have.
Oh, totally, yeah. And then the whole confirmation bias thing too is where, what's funny to me, kind of, is where somebody will get in a new relationship. They'll start telling me all about this person, and then eventually maybe you'll bring them in and you'll do a little couples therapy, and they're not quite exactly the person that they've been portrayed to be. So you see that
they're better. Or
no, it's just a little bit worse. Yeah, because usually like the person will be my client. I've helped them through maybe a divorce, then they start the dating world, and then they just start talking about this person who's amazing and bubbly and outgoing, and he's so dynamic, and then he comes in, he's a little bit of a dud, and I'm like, oh, she's making him into that, right?
She really wants it. She really wants it.
Yeah. And it can be either
so
way.
Funny.
Yeah, the guy or the girl. Okay.
Oh, that's sad. Oh, okay. Then the other one that I thought was really cool. Oh wait, where is it? Where'd it go? Tips. This is for you. I know it's kind of a birth thing, but I'm curious your thoughts.
Okay.
Tips to cope with body image changes after birth.
Yeah.
So she wrote as examples, multiple prolapses and destroyed pelvic floor. Yeah. But in general, what's your thought process on it? Because a lot of people struggle with that, which I'm sure you know.
Oh, for sure. And I want both your thoughts on this. So I'm a big acceptance and commitment therapy therapist. We talked about that by the pool a couple of days ago, ACT, acceptance and commitment therapy. And that one starts with a place of acceptance. So there's nothing wrong. You're not broken. That this is the first time that you were you in that situation, and that is happening.
Yeah.
So then check that out. So it starts from instead of man, this is so bad and what's wrong with me, but it's like, oh, this is what's happening. This is how my body's responding. Because then you go into this concept of acceptance doesn't mean apathy. So acceptance doesn't mean that, well, I guess I'm doomed to just feel bad about myself for the rest of my life. But acceptance means to take in without defense in its entirety. So if I accept the fact that this is what has happened, then I'm not trying to continually ask why and what do I need to do different or what's wrong with me or what are people going to think. It just is. And so now if I go interact in the world and go do stuff and hang out with people and whatever, then there will be times where I'll be really aware of those body image issues. But then I'm also having these experiences where I'm interacting with people, I'm making connections, I'm going out and doing, because I find that so often people feel so bad about body image issues that then they just avoid things.
Right.
So in that avoiding of things only, it kind of like compounds, and perpetuates the problem.
Yeah.
And that's one where then the thoughts are one of two, where one, then somebody will say, oh, so then if with that acceptance, then they'll start to do or take action on things more. And I come from the camp of not necessarily, but you'll start to realize, oh, I am okay.
Yeah. And that's the issue. It's like when people don't think they're okay. Totally. It's not that you have to change yourself.
Because that gets deep, where if you don't feel good about yourself, then you're going to almost like, I'll be happy when. So then I'll be happy when if I can lose some weight, if I can do this, if I can do that. And then I get there and all of a sudden I'm like, still not feeling so happy. So now maybe it's another thing versus I need to learn how to be accepting. Yeah. So that's
self-validating.
I feel like society oftentimes like makes women feel like they have to look at themselves as like some kind of like sexual object all the time.
For sure.
But the reality is like your body just did that. Like, that
is so cool.
That is literally like beyond amazing. Like that is beyond a miracle. Like that your body like changed so it could hold that and then pushed it out. And it's like, first of all, don't compare yourself to how anyone else looks. Like that's never start there. Like I feel like that's a big problem we have. And also like,
or even to your old self. Like a lot of people are like, this is the biggest I've ever been. Or like they say that a lot. And just with what you're saying, like in a way, well, basically all the time I say stuff like, it's when someone's lost weight or something, I just say, if they're so excited about it, I'm like so happy for them, of course. But like, I love to say, isn't it cool how our bodies can change? Not like you lost so much weight. That is so awesome. Like that's not even the fact. It's like, to me, the fact of it is that it's so cool that our bodies morph into tons of different things, whether it's pregnant, not pregnant, healing after surgery of any sort of like, it's just so cool that we can do that and that our bodies are resilient and that you can gain weight or, a lot of people need to gain weight or lose weight or whatever. And so instead of being like, oh my gosh, you lost weight, you look so good. I love if they're excited about it and telling me about losing weight. I just love to say, it's so cool that our bodies can change. Like, isn't that so cool? Because of what you're saying, like your body just, in this case, in birth case, your body just held a baby, grew it, literally was depleted of nutrients if you don't eat a certain way, and grew a perfect child, and then pushed it out, basically could have pushed out on its own. I usually tell my clients you could give birth in the forest by yourself and you'll be fine for the most part. For most of my clients, I think that they would be fine on their own. And that is freaking cool. And then after like 2 weeks postpartum, they're worrying about what they look like. And I'm like, this is the season. This is a good season that your body's holding on to that so that you can be nourished. Like it is not thinking about getting fit again. And you shouldn't be either. But of course, society does that. And so we do think that. And in this case, I don't know exactly how it works, but you would say, check it out. I'm thinking this. And
totally. That's why I like, exactly. Process. So that and I always like started, so first time that you've ever been you in that position. So I like what you're saying. First time I've either pushed or had a baby, or I've had a second baby, or a third. It's always going to be the very first time you
every
have
day
been
is the first day.
Yeah. So check that out. This is how I feel in this moment. And then because we sit and I talk about it, there's a ton. You have tons of thoughts and feelings and emotions all the time. So why do we give certain credibility to ones and not others? So I might feel like, man, I actually feel pretty good. But then I might think, oh, but is that bad that I feel that way? Now that one's gonna stick for some reason.
Yeah.
And can I just say, like, just like you're beautiful no matter
Thank
what.
you,
No
Sid.
matter you're
She always
so
does it. Thank
beautiful.
you. So nice.
No matter
Really
what.
specific.
She did.
Only you.
Touching very moment.
But like no matter what, just because you don't look like Kim K, just because some random old man in his basement doesn't want to F you, that does not mean you're not cute. It's like serious though. Like you are beautiful because you say you're beautiful. And it's like you're beautiful
Doesn't want to
after
follow
the
you.
baby, before the baby, during the baby. Like you're just beautiful. Like just because some guy doesn't think you are, that's like weird that he's thinking about you so much. Like he's obsessed.
That, and I like when we go there. I mean, there's sometimes when Mackie's out there moderating, which I so appreciate. Love you, Mac. But then when she isn't there, people just say the most random things like "you're dumb" or whatever. And it's like I'm supposed to go, "Oh no, they think I am." Okay, Wendy's here. So she's gonna start.
She said, "Preach,
preach."
girl.
Hey, that's Cloud Hetty, preach, girl. Thank
That's
you.
awesome.
Okay, did you have thoughts on that too?
I was just gonna also touch on a lot of what I believe, or like if I'm wondering and curious about what I believe about something, I usually say like, what did they think like 1,000 years ago?
Yeah.
500 years ago. And in this instance, like they were not trying to get fit.
No.
Right away after birth. Like they were very, they were honoring their body, and they were just like totally cool with being the size they were, not caring. And I think that's really cool because I mean, that goes to, for a lot of my beliefs, right? With birth, with all that, they didn't have epidurals, and I'm like, that's cool. And like, whatever, you know, but with this topic specifically, I just think it's really like, we've really gone a wrong way for many things.
Yeah.
And that is one of them.
Do you think it'll swing back around? Or
I think it is coming back around, but I think it with this kind of stuff, I do think it starts with the holistic community, which is kind of shut down right now. You know, people like are like, you're stupid, you're dumb, like whatever, which is fine. Like we benefit from it. So it's like, whatever, you can take it or leave it, but it's really cool. There's actually, I'm going to do a little shout out, but this account that I absolutely love, her name or her account on Instagram is Rewild Mothers. And basically every time she posts, it changes my mind about something.
Really?
And I'm like, that's so true. That's really cool. So if you have an Instagram, I would go check her out. She just like has a lot of old, like I wouldn't even say old school. I would say like ancient beliefs that she'll say something that makes me wonder, like, why have I even thought that before? And then anyways, it's really cool. So
hang on. I have to do a puzzle or it shuts down. It's not crazy. I know, that's a nice puzzle.
Good job.
Did I win?
Good job.
I won. Okay.
You won.
Kelly says, nice that with Kelly's, we love Kelly. Kelly's here often. Yeah, good to see you, Kelly. And then Cloud Hetty, I'm new here, and all three look peaceful and beautiful. Yes. Thank you.
Oh, that's so
okay. All right. On point quilting by Marsha. My midwife had me stay in bed for a full week after birth.
Yeah. So we say 40 days. Oh, sorry. I couldn't
get
in time. We say, if you go off of the Chinese culture, they say 40 days. So obviously in the US, people are not going to stay in bed for 40 days. But here with my clients, we say 5 days on the bed or in the bed. So like laying down, 5 days on the bed. So that just kind of means sitting somewhere. And then 5 days around the bed, which just means like walking around very small places, not like going to a farmer's market and walking around in the heat for hours.
Yeah.
So it's technically 15 days that my clients go off of, or that we tell our clients. And if I go to their house for their postpartum visit and they answer the door, I'm like, what are you doing? Excuse you. You go sit down.
Yeah.
Because people forget that you do have a wound inside of you that's trying to shrink.
Wow.
And that's why someone was just saying, I can't remember who, and it's probably a good thing I don't remember who, but she was saying that her mother-in-law was like, you're going to be just sitting around the first week after birth? Like, what do you mean? And I was like, let me talk to her. Like, because you just literally did for 9 months, grew a human, which is so exhausting. And then you pushed out a baby, and that now you have to heal. Like you may have vaginal tears. You may have, what's it called? A C-section scar. You may have the placental size that is shrinking down. Wound. And also you're learning to feed a human, like, you know, you guys know the drill, just like it's a huge change. So I think it's very important to answer On Point Quilting by Marsha. That's a great tip. To if I could change anything about my first birth, because he was a hospital birth, it would be 1, to not do a hospital birth, but 2, to stay in bed postpartum, to just not like want everyone to come over and be oh, let's go somewhere. I want to go somewhere. And that's super hard to fight when we have hustle culture in the US.
Yeah.
But really, really important.
Yeah. Okay, Claude Hetty, I'm new here. May I ask if you guys are friends or family? That matters. I'm just curious. So that's my daughter.
Did you forget?
We're a family. And then we are family now because of my daughter is married to your...
Yes, my little brother. My little brother married her sister.
Yeah.
Which is his daughter's.
And they just had a little baby.
Yep.
Yeah, they did.
New nephew, new grandchild, new nephew. So fun.
Okay, point cool thing. I love that younger people are doing home births. I did mine 32 and 33 years ago.
That's awesome. See what I'm saying? When you go back years, you see what people used to do, and it was normal.
Is that pretty? I always say, is that pretty wild to hear?
No.
That was more normal then.
No, it was more normal.
Oh yeah, of course. Okay.
Yeah.
Yes.
So then it became. Well, I'm not going to get into the history of it. Go look up the history of home birth. You'll be shocked. You'll probably be annoyed at doctors, hospital people.
All right. Do you have more questions?
Yes. Okay. This is the controversial one.
Okay. Are we ready?
So someone messaged me about this, and she said, "I wish I could ask this." She said, "It's not a safe question to ask, but I wish it was safe to ask if he thinks that the LDS Church has narcissistic tendencies."
Oh, yeah, for sure.
That's what I wrote.
Yeah.
I said, I think he does. But
Yeah. So, I mean, and it kind of goes back to that because that's a lot of the population I work with. And so then if you just kind of look at emotional immaturity, or actually look at this, I have some notes up here, right here, where, right. Because so I've got this podcast called Waking Up to Narcissism. And early on, I made a pretty intentional episode where I talked about narcissistic personality disorder is like 3 or 4% of the population, but we throw it around like it's 50% of the population. You know, everybody's a narcissist. Everybody's boss is a narcissist. Or
if you don't like someone, they're a narcissist.
Yeah, exactly. Right. But I really believe that then if you look at what emotional immaturity is, then all of us are emotionally immature in areas, but we can become more emotionally mature when we are willing to take in data, self-confront, take ownership of things. And so sometimes if you look at, are people open for change, or people looking, are they more controlling? And so let me just read a couple of these things here. So narcissism, characterized by an inflated sense of self-importance, a need for excessive attention and admiration, a lack of empathy for others, and that can lead to a lot of troubled relationships. And so a lot of times a narcissistic person is going to feel superior to others and believe that they deserve special treatment. They typically have fragile self-esteem, and they can be really sensitive to criticism. So you can start, if you have had experiences like that in a faith community, then I think oftentimes, and this is one of those difficult things where you can look at leadership roulette of sorts, where some people are going to say, no, that never happens. But then other people, I mean, I've worked with enough leaders where they don't want to be wrong. They don't self-confront, and they do want that validation. Yeah. So they might put themselves in this one-up position and then want to tell people, this is what I think you need to do. And I'm working on an episode right now about being differentiated within a church from a church leader, where every single thing at the end of the day is a me thing. So if I'm interacting with somebody and they're telling me what I should do, ultimately that's a me thing. I get to decide if that's something that I think is good for me, not good for me. And I think that concept of differentiation is really deep, because that really is, if I'm just sitting around doing nothing, then I'm not going to grow. If I'm interacting with another human, an organization, an entity, then it is going to give me feelings and experiences. They're going to help me know myself better. But what that might be is me then realizing that this isn't a safe place where I don't feel heard or understood. Yeah. But if you look at emotional immaturity, people who haven't developed skills or emotional capacity to deal with like adult life, and in essence, so inability to manage emotions effectively, poor impulse control, a lack of empathy, difficulty maintaining relationships. And really emotional immaturity is a lot about frustration tolerance, or what do we do with our discomfort? So then if somebody says, I have a different opinion, and then and this is where you start to look at, like, can a relationship with a church, a leader, a spouse, is there room for two opinions? Because differentiation is where one person ends and the other begins, and that's, most of us are codependent and enmeshed with our partner, with our church, with our family. And so then we start to have experiences and we start to feel like these are my experiences. But then if somebody says, well, you shouldn't really feel that way, or you shouldn't think that, or you shouldn't do that, then that's a lack of differentiation. And that's where I feel like that's that emotional immaturity.
Yeah,
Where
that's
then it's
so
like,
interesting.
yeah. So
I hope she's on right now because I think that's really cool.
well, and we can make these clips or that sort of thing.
Oh, yeah,
but then, I mean, if you look at an institution as well, where sometimes I look at this concept I call institutional gaslighting, even, where if somebody says, somebody says, I'm pretty happy, but they're saying, no, you're not.
Oh yeah, I get that all the time.
Right. And that's like that one. I wanted to say how adorable that somebody knows my happiness better than I do.
Yeah, that's so cute. You know me
Right?
so well.
Yeah. And
interesting.
Well, and I think part of it too is that stuff where we're talking about taking ownership or being willing to say, my bad, I think is a really healthy part of becoming more emotionally mature, of acknowledging that this is something that we haven't done well or haven't done right.
Yeah.
And
that's
immature
sometimes.
Yeah. Yes.
In that area.
In my experience,
Yeah.
In my experience at the church, it was 100% lacking because, like, from what I remember at least, you weren't allowed to look at anything outside of the church, or else it was a sin.
No research of any kind.
Yeah. So to me, that was like, it was like a very good way of keeping you in, and it also was just like, looking at it in retrospect, it was this idea that, oh yeah, this way is the only right way, which if you believe that, I'm glad you're comfortable, and I'm glad you're happy genuinely, but just to think that anything is the only right way is a little gullible, I think.
Well, and I was trying to talk to Allie, and I appreciate that, and tell me what you think about this, Sid. When we were talking outside a couple days ago, and I was telling you my theory of if there's a right way, then everything else is the wrong way.
Yeah.
So in this one, I really think that kids growing up, even the best parents, trying to teach their kid right from wrong. And so, but then a kid is just interacting with the world for the very first time, and they're being impulsive. And so then the parent, though, wants to be like a good parent. So they're saying, oh, hey, we don't say that, or we don't do that, or calm down. And so they're basically telling the kid that your emotions, your feelings are wrong.
Right.
And so then I'm speeding through this part, but then the kid will eventually internalize their emotions. So they won't externalize them. So now they need somebody else to tell them they're okay, or tell them that's okay, or you're doing good.
Yes.
So they rely on the external validation from somebody else. And when we talk about like a kid gets their sense of self from external validation, there's a good version of that where if the parent is not making it about them, then they are saying to the kid, hey, tell me what you want to do. Tell me how you're feeling and thinking. What's that like? How can I support you? Not, ooh, I don't like the way you're doing that. Or I don't think you should do it that way. Or I think you need to try it this way.
Yeah, more like with curiosity.
Yeah, exactly. So that's thinking about the kids. So take that now. If you've got a faith community, for example, that then says, okay, well, actually there is a right way. So now all of a sudden, the adult is trying to live up to the standard of I have to do it this way. So if I want to do something that doesn't fall in alignment with the right way, I'm doing it the wrong way.
Right. It's only right here.
Yeah.
That's it. You can't step.
And so then if there's a kid and they're just being a kid, now meanwhile, they're probably doing a lot of things the wrong way. So they need to be told what the right way is. But if the adult doesn't even know if they believe that that's actually the right way also, then you kind of both people are operating from what's called a false self. Yeah. So they're just both trying to be somebody that they're supposed to be to get the validation. Yeah. And I think that can have a lot of people feeling like that emotionally immature. So now I have to have somebody else tell me that I'm okay. Yeah. And so I get that okay through the positions I hold, through the things I do, because now I'm being told you're doing it well. And then if I don't get in those positions, then that must mean I'm doing it wrong. So I got to go back to the drawing board and feel like, what am I doing wrong to then get the validation? Yeah. Yeah.
It's so cool though. Yeah. I feel like when we talked the other day, like what you're saying. Yeah. That was the first time that it kind of clicked for me where I was like, oh my gosh, that makes so much sense. Where, I don't know, the black and white. Like I very much am in the middle or the gray area with a lot of things in my life. And I feel like I'm good with that. Yeah. But I do know a lot of people that like the black and white. Yeah. And they need that.
Well, we talked about that a little bit, right? Because what's interesting is that for some, that really is a way to not have to take ownership or accountability of things. Because now I get to say, well, but I was told that this is what I'm supposed to do. Yeah. So what was I supposed to do?
Right. That's what I was told that.
Yeah.
So.
And because it's super uncomfortable to go against the grain of what you're being told that you're supposed to do. Yeah. And what do we do with our discomfort? I mean, it's easier to like not
sit with it.
Yeah. Yeah. Right. But when you sit with it, that's where the growth occurs. Is that discomfort.
And like curiosity in yourself and why you did something that might have been in the gray area and wondering, like if I do something that's in the gray and people, which inevitably will be like, you shouldn't be doing XYZ because they want a black and white thing, then I'm going to say, why am I doing that? And then I'm going to say, well, because I believe X, Y, Z, and it's fine to be in the gray. And then I'm more confident. I'm just using myself because why not? Then I'm more confident with being in the gray, even when people don't like that. And I feel like since stepping away from the church, it's been so much like that. But one specific day, it literally just snapped where I was like, I actually am doing what I feel is right, and that's okay. Like,
and you felt
it's okay that I'm in the gray for some people. To me, it feels good, and I know why I'm doing it.
Yeah.
Whereas before, I was in the church, a specific church for everyone, because I was told to be in the church, and that was the only reason. You know, like, I mean, the only grand reason, right? I liked a lot of things about it, but I just didn't sit well with me.
Yeah.
And one day I literally, it was like a specific moment. I was just like, why am I doing this? And when I did realize I felt better doing something else, I felt confident about it. And I was just like, I think I'm good. Like, I think I don't need anyone to tell me this is what you should do and you need to be wearing this kind of clothing and whatever.
And that part where you said, I think I'm good, I think people are afraid, that's that fear of the unknown.
Yeah.
Is that uncertainty of what if I don't find out that I'm good, and what if I feel worse?
Then you can go back.
Well, but I mean, that's, I think, what keeps people from
exploring.
Yeah.
You know, I have a friend that she's literally one of my best friends, but she one day said something to me like, I can't even dive into it because I'm scared. And I was just like, that's okay. You don't need to. And that's what I say to my husband, who's still in the church. I'm just like, if you feel joy there, that's chill. Like, do it.
Yeah.
But like, when you don't feel that and you feel uncertain, that's when I'm like, I really wish people would have the confidence to say, I don't need to do this. Like, I don't need to do anything. And I feel good at doing X, whatever it is, whether it's staying in a church or not going in, whatever, I don't even care.
Yeah.
Just like whatever you're doing, feel good about it and kind of not know your why, but like question yourself and like be curious about yourself. Like, why am I doing this?
Am I looking for validation? Or am I doing it to get rid of my discomfort?
Or does it just feel like it makes sense to you? Or does it feel good?
Because I think you're choosing it instead of like
you're actively
being compelled
choosing
to do it.
Exactly.
You're choosing it.
It's not like being acted on to, like being, you're like a thing that it's happening to you. You actively get to choose what you do in life. And I feel like it's important to be confident that you're doing what you want to do. It goes back to anything really, like in anyone's life, even career. I remember when I was on the path to be a nurse. Sorry. I wanted to be a NICU nurse and L&D nurse my whole life. My family was so excited about it too. You know, everyone was medical in my family. I have a brother that's a doctor. My sister's a nurse, like all this stuff. So when I decided to drop out of nursing, it was like not cool. Like my parents were really concerned, which rightfully so. They want me to succeed. But I just didn't feel good about it. And luckily I felt at that point too, of course, because I decided to do it on my own. I felt so good. I was just like, I will figure out what I want to do. And I feel good about it. And it was just such a freeing moment. Like, you don't have to do anything. And when you do decide to do something, make sure that you feel good about doing it and don't feel, pressured, like pushed into doing something because you feel that weight around you. Like, I have to have the black and white, which I don't even know. I shouldn't be shitting on people, but
that's okay. We were talking, I think we're also talking about in the world of acceptance and commitment therapy, there's the concept of a socially compliant goal. It's something I do because I think I'm supposed to. Or if I don't do it, I'll let somebody else down. And so I think most of us are starting by living a life full of those socially compliant goals, because we get our values from our parents, our church, our community. But then it's like that process of becoming is starting to recognize, okay, actually, what do I want to do? But then here comes all the discomfort, or I want somebody to tell me it's okay. So you kind of have to know that it's okay, and it is going to be uncomfortable. But
your whole life is based on if you're okay with discomfort.
Totally. Oh, that's yes.
So interesting.
I think it's about, we talk about, we want certainty, we want to avoid discomfort, and we want validation. So when you can learn to self-validate, learn that we grow through discomfort, and then know that nothing's certain.
And like personally, like I was getting so much validation from the church, and I didn't even realize that I depended on it so much. So I feel like I relate to you a lot, where like when I first left, it was so uncomfortable. Because I feel like you're the chemicals in your brain are like earning for this, and you don't have it anymore. But then totally, like, once there was a day where it just like it snapped into place, and like I felt like so much better. And I think that was because like I finally could give that validation that I was getting from the church to myself.
Yeah, that's so cool. It goes all back to that circle that you're saying. Just seek for the self-validation.
And
then they really put that together.
That's cool.
Well, if you spend, and this is where I think this concept of implicit memory, or what it feels like to be you or me, is based off of this slow residue of your lived experience. So the more that you find yourself seeking validation and not willing to sit with discomfort and seeking certainty, and you do it over and over and over again, then that becomes kind of your default. And so then if somebody's suggesting that you sit with a little discomfort, then you're going to but that. Well, but this person said I need to do this, or this person, and then that's where I think the way that somebody alleviates that discomfort is by kind of putting that on somebody else. Well, what am I supposed to do? This person said this, or they told me this.
Interesting. And I mean, everything I'm getting from what you're saying is basically that you could probably answer everyone's. I'll answer that in a sec, Laura. Or I think that's to you, actually. I think both of us could answer it, but you could probably answer anyone's problem or question with like, or issue that they're dealing with like, of course you are. You're only you, and like you've experienced XYZ. Of course you.
And then most everybody is like so used to getting told how they're supposed to think or feel, and so then they drop into the like defensive. I talk about it all the time. It's reactance, the instant negative reaction of being told what to do. So then once somebody says, well, you need to do this, then our immediate immature response is just like, I will not do that. So then if somebody has said, well, tell me about doing that, or tell me what that's like for you, then we're more likely to just start to kind of figure things out on our own. And I find that so many people that come into my office have been living this life of trying to do things to make other people happy, and then being told what to do. So then they're also then being very defensive. So they're spending wasting all these emotional calories on trying to defend themselves on things that they don't even think or want to do, or become somebody that they don't really want to be to get validation. And all of that is not figuring out who you are.
Right.
Yeah.
But you literally have to rewire your brain, right? Because like babies, they need validation to survive, right? Because like for a baby, that would be like, well, for you know what I mean? It's like you need everyone around you to care for you all the time. So like that's what you grow up thinking that you need.
Yeah, we talk about
that. How do you separate?
Well, it's such a process. We talk about like when you literally, now tonight's theme's been birth. You exit the birth canal and you are a little squishy baby, and you cry and you emote, and people are there to take care of you.
Right.
So like we're wired to, when I express emotions, somebody takes care of me. And then you get a little older, and now you're literally talking and you're saying, I want candy before dinner, and people are saying, not now, champ. So all of a sudden it's like, wait, but I'm expressing myself. Where's the part where everybody jumps around me? And then that's where because the little kid, I would say little kids are by definition little narcissists. So they are egotistical. And they don't have like a view outside of their self. So now all of a sudden it's like, okay, if this old man's not getting me hot tamales for dinner, then he must hate me. Like and that's where the shame comes in.
Yes.
Like something must be wrong with me, because I am wired to express myself, and everybody jumps.
Yes.
And now everybody's like saying, oh, he's adorable. Look at him wanting that candy. No, buddy, we don't have candy for dinner. What are you, nuts? And then all of a sudden he's like, gosh, I guess something's
world
wrong.
Comes
right. Yeah.
That's all that your world is.
My 3-year-old yesterday asked for, I don't even freaking remember what. It was like midnight, and she started asking for something, and I was like, go to bed. Like, we're not doing this, whatever. And she started crying. She said, I don't need anyone anymore. I don't need anyone. And I'm like, she is like trying to get me so good. And I'm like, drama. What? You don't need me. Like, she's just so funny. But it is like,
it is that.
She needs to find a way to get that. She's like, what do you mean? Like,
right?
You just, like, you're my mom. You're supposed to give me everything. And I'm not giving you a freaking candy at bedtime.
Okay, well look at that. Like, that's one where I always give this example of where kids at the store, and they want the toy, and they're screaming their head off. I'm sure you've never had that happen, right? And so then eventually, what does the mom say to alleviate her discomfort? Okay, this one time, but we're not doing it ever again.
That's so nice of her, though, because I don't want to do
well,
that.
I was saying, that's why, because like, then sort of that the mom feels like, okay, no, I told them this is it. And to the little kid, they're like, I got my toy.
Right. And they're like, okay, I know what I need to do.
Exactly. So next time I'll go bigger and bigger. And then finally they're like, okay, this is it though,
Yeah.
Literally,
of course,
like
which I totally get that. I get why parents do that. It's so hard to do that. And you're like so many eyes are on me. But honestly, this is a side note, but like people don't usually care. People do not care about what you're doing. Usually people are worried about their doing themselves.
Absolutely.
So like when I'm in a store and my kids are freaking out or whatever it is, I try and think that like no one really cares what's happening. They're also never gonna see me again. So I'll let my kids freak out.
Right.
Yeah, let's go to the car. We're not doing this. I don't know who she was asking.
Oh, you guys both can go, right?
Do you have a way to answer that?
I don't know.
I know, close my eyes.
Yes, close your eyes. Answer.
Right now you can't see me, right?
I mean,
No, you're good.
Oh, I don't care.
You put me on hot.
Yeah, well, the question Laura says, is it tough still having your dad in the church? So you guys both
I'm
were
assuming they're asking you that.
I don't know.
But my dad is in the church as well.
It is what it is. Acceptance.
I'm not good at accepting.
I'm happy if anyone's if you're happy where you are in your life, then who am I to change anyone's mind? You know.
Okay.
That's such a nice answer. You sweet girl. Yeah, that's a great answer. I'll say the same thing.
I'll ditto that.
Okay.
I feel like it does depend on how the parent is. Like, I feel like if a parent, not mine, I'm just saying in general, is thinking of you of leaving the church as like it's a bad thing, then it is going to be hard. Like, but if it is an acceptance thing, or it's like, hey, I'm there for you no matter what, and it's just like, it's just a thing. You just left. It's not bad or good. Yeah. Then it can be awesome. It can actually be a cool bonding experience of like curiosity. Like, okay, so what do you believe now? Like, I have some friends that they are still in the LDS church, and they will be like, so what do you believe now? Like, they're curious, and that makes me feel good. Yeah. But when people shy away from it or they're taboo, I understand because they're nervous. But it is a little bit more. We can't connect on that on any level with that. So I feel like I would that's what my answer with that. It depends on how the parent would be in general.
You're totally like taking into like the differentiation concept, right? It's like
sweet. I just don't know what to call them.
No, it is. Well,
we can all just be whatever we want to be. Like, we don't all have to be the same. That would be so weird.
Super boring.
Yeah, it'd be so boring.
Boring.
So this is a episode I'm working on the virtual couch for this reflected sense of self, and I think this is part of what we're talking about too. When you depend on others to tell you who you are, it's like looking into a mirror to see your reflection, but instead of a mirror, you use other people's opinions to see yourself. And then the more you rely on what others think to feel good about yourself, the harder it is for you to handle criticism or feel less than perfect. And I think that one's a deep concept there. And a lot of times what people will do is then, they don't. And it's like, I think what you were saying earlier, they don't want to hear about your experience because that's uncomfortable. And then that might mean that means they could maybe have a different experience.
Yeah, and they could be wrong. And
and that's
not good.
Yeah, that's tough. That one.
And that's like, again, is them kind of just avoiding their discomfort.
Yeah, exactly. Yeah.
But also from being like literally in the church, like, again, like sometimes they tell you that you can't look at outside things or it's a sin. So I understand how that could keep people away from doing it too. Yeah. It's really tough. Like when people do bring that up, I always want to make the joke of, I missed that day, where they talked about looking outside, but I know that that is the message. And that, I know, well, I'm just saying it because, I was there. Well, and I'm just saying it's because there are some people that it is fascinating to see what really bothers some people and doesn't bother other people because it's so different.
Right, for sure.
And so,
also, everyone's different. Yeah. So like it might bother someone because they had a specific experience that it's bringing up or whatever, everyone's so different that it's like, it goes back to, you could be like, of course that would bother you because you're you. Like, of course, like that makes so much sense. And like, I love you anyways. Yeah. Like, I just wish more people were like that. But obviously I even struggle with that. Well,
and I've got a men's recovery group for people that turn to unhealthy coping mechanisms when they're feeling a lack of connection in their marriages or their parenting or their faith or their health or their career. And in that world, a lot of times I have recognized, so I grew up without really much of any religion. Mm-hmm. So then I make this joke, because I joke about everything, but that I almost had to learn the shame. Like, okay, so I feel bad about that? Okay.
Oh, it's supposed to feel bad.
Yeah, but then it was like easier than to kind of then undo that.
Yeah.
So then I know that when I'm telling people, you're okay, it's all right. That then I'm talking to people that have had 40 or 50 years of, no, you're not.
Yes.
And that's hard.
Yeah.
That is so tough.
That is a good way of like putting it. I didn't think about it like that.
Yeah.
Because for me, it's like if someone were to tell me I'm okay when I'm feeling that shame, that doesn't mean anything. It
know,
means
right?
nothing.
All right.
That shame is just like who I am to my core. You
Because
know?
when I have somebody that does, I use the word setback because I'm not a relapse setback, but when somebody does it, I always say, okay, that happened. Don't go on a bender. Review the game film. What am I pretending not to know? Don't beat yourself up. You're good.
Mhm.
And it's almost like that formula over and over. But then I realized that's it sounds easy, and it is for some, but for others, it's like, no, I feel horrible because I did this thing. Yeah. Talking about discomfort, and then maybe before we move off of this topic too, I really like the thought about when we do confession at times, that I think a lot of times people are doing confession to alleviate their discomfort. So that if they feel bad about what they did, they want to confess to someone. It can be a spouse, it can be a church leader, and they want to say, I did this, because they want that person to say, you're okay. But then they're handing that power over to somebody else, and that person might say, wow, you did what? And then they feel worse. You know? So, but then if you are turning to somebody and that person is a safe person, and that person can say, hey, how can I help? And I think that confession can be beautiful,
Right.
Yeah.
Oh, that's, yeah.
I like this. Kinsman says, can we hear more from the middle one?
So
You're the middle one.
The middle one. So beautiful.
Tell us more, middle one.
There's not much going on in here.
No,
she's got a lot.
Okay. Bagel Bob. Do you want to read that one, Allie?
Had one date with the dismissive avoidant. Getting ghosted now. Is there any recovery, or do I pursue?
I want your guys' thoughts on, because the whole ghosting
Explain
thing.
Dismissive avoidant.
Well, so we could get into the different attachment styles. A dismissive avoidance basically going to be somebody that is like an avoidant is somebody that is not going to pursue or not going to chase in a relationship. Okay. So they're withdrawn. And so then if Bagel Bob's more of an anxious attachment, then they're going to be the one that's like, what did I do? Like, are we okay? Reaching out. Okay. And so then you got this ghosted. Is there any recovery, and do I pursue? And man, Bagel Bob, I would immediately just go right out of the gate with, I would rather not have someone pursue, but you're the only version of you, like we were talking earlier. And so then if you are going to pursue, then just do so and be aware. What?
Someone's saying that person's
gone. She gone, forget her. Yeah,
they're gone.
TikTok's there. And that's what's fascinating about that is this. This is, I remember when I was in grad school, and my professor, Darlene Davis, she's the best. She said, you're going to hit 10, 15 years in, and you're going to have seen everything so many times, and you're going to just say, yeah, it is like what TikTok snack just said. Hey, you're good. Like, don't worry about it. But then that person has to go through that experience themselves. But okay, tell me about ghosting, because I do feel like this is something where I feel like I'm old enough that it wasn't a thing a decade ago.
Okay, it wasn't even a thing. Yeah. So I was dating. I was married 9 years ago, so I don't remember that being a thing really at all.
Oh, I know all about this.
Okay, middle one, tell us.
I wonder why it is a thing now.
Ghosted for that?
When I was very immature, I definitely ghosted. Okay. I never ghosted anyone that I actually met in real life, because that would be, it's awful either way, but I definitely have had done it to people before. Why? What? And was it just confession time?
Yeah, tell me more about that.
It was just
more about that.
It was never because of the guy. It was always a me thing. It was always me being like really anxious, and like I hate texting people. So like,
boy, she does.
So I would literally like a guy and have like the fattest crush on this guy, but I just can't text him back, so I'll ghost him.
Because of the anxiety.
Yeah, but that being said, like even if that's happening in this situation, you deserve better than a girl who does that.
Yeah.
Okay, you deserve someone who's not going to ghost you, so leave her. Like, I would tell anyone to leave me at that time.
Okay.
I would, because, like, you deserve better than that. Well, and, like, it's not that hard to text someone back.
Okay,
I mean,
wait. Clip that. Wait, the time code.
But I wasn't ready for a relationship.
127. I'm talking about with your dad.
Oh, what?
Like,
what are you
texting your dad back. Like, that's okay, right?
What?
Like, do you text your dad back?
What's that?
Do not disturb all the time.
What's that?
Oh, yeah, you're right. That's fair.
Yeah.
Okay, that's fair.
Oh my god.
It's not. I could just notify anyway.
Oh yeah, you could.
Wait, you guys, I was talking about something.
Okay.
What was I talking
You were saying the ghosting.
Oh yeah.
Yeah.
Well, are you just being nice too, like saying it was always me, or were guys that would be a pain for real?
I like it.
I'm for real.
I'm being so serious. Like it was me most of the time, and it was because I still like the guy. But there definitely were some times where it was just. Yeah, with the first.
Because I think that tell me what you think about if there are people that are really just kind of being a little bit creepy, And then that's where I think
that's different.
Yeah.
Okay, but
you're
that's
not
totally
ghosting them.
different though.
okay, but I think that's where sometimes people are trying to, like an emotionally immature guy might be continuing to try to keep a conversation going, even by pushing buttons to get you to respond. Have you ever had that experience?
Yeah.
Okay.
I blocked him.
Okay.
That's technically
well done.
ghosting, but for a good reason.
Yeah. But obviously, if someone's just ghosting you for no reason, like that's horrible. Like that's like what like.
I
That's
wouldn't say it's horrible.
horrible.
I would say you might be lacking tools.
Yeah.
Like or you're not ready to be vulnerable. So like I don't know.
Okay,
what about you, therapist?
Well, I was reading this, like, just have ChatGPT do it for you, and I have people do that.
Dude, I should have done
You
that.
can do it in a limerick. You can do it in like a rhymed couplet. You can do it in a country song.
Honestly, what is happening
Yeah.
to our
Yeah, like I think that's
Oh
I think that's
my
a good one right there. Okay, Southern Ashes. My algorithm has brought me here correctly. Welcome. We're glad you are here, and thank you for being here. This hour and a
it's
half
so
in.
fun.
It is fun, huh?
So easy to talk to.
It is.
So
Okay.
you guys are sweet.
Thoughts on mindfulness meditation before sleep? Are you a meditator? Honestly,
I will say I always. Oh, this is probably controversial. I kind of make fun of the meditation that's like usually for birth is what I listen to for my clients. I help them find birth ones.
Yeah.
But I make fun of the ones that are like, you're like a flower opening. I don't like those.
Okay.
I do not
Yeah.
mesh well with those.
Yeah.
The ones I listen to, I say that they're like life lessons in meditation form.
Okay.
And those are the ones that I really love, which I'll send you guys after.
Yeah.
Do because I like those as well. And we both are big meditators.
If you guys are listening, look up Sarah Blondin. She's
know that,
amazing.
yeah.
I love her
Yeah.
stuff. Her voice can put me to sleep. But it's just like I love meditations that will help me think about something and kind of have closure to a thought that I've been having, and then I can go to sleep.
Okay.
But I don't do it daily. I just do every once in a while if I'm having like a hard day. I do a check-in.
Okay, so I will say, and I went big on this I had a facilitated men's group tonight, and we were talking about somebody just said, we were talking about grounded responding, so not trying to be overly reactive when somebody is pushing buttons. And I was saying that mindfulness is the number one tool to get to that point, because I really think that when you jump into being mindful, you're learning how to lower your resting heart rate. And because I think it really is all how quickly your cortisol shoots through the roof and gets you into that fight or flight response.
Yeah.
And so the more you can build in that pause, I think the better. And that pause comes from like a daily meditative practice, because you're starting to lower your resting heart rate, and that gives you more time to just kind of be present before you react.
That's awesome. I think that's really cool.
There's a few hours of TikTok before bed count as meditation. Boy,
Opposite.
I have done that.
Opposite.
Yeah. And then Kylie, where did she get her pants?
Where'd you get your pants?
I thrifted them, but do you want me to look at the tag? I'm gonna look at the tag. I feel so annoying when
I know.
Okay.
I hate when that happens. You're like, it's thrifted.
Okay.
Oh, the name is Sarah Blondin, like the color, like blonde, but in at the end, Blondin.
Let's see. Okay, Nims, I like the girl, and she is pulling back. How to deal with bad feelings. So Nims, what I'd be so curious about is are you more of that anxious attachment? And so if she's pulling back, were you starting to get a little bit? What's a nice way to say it? A little much, a little bit.
Are you going on too strong?
Yeah. Are you being an aggressive pursuer? Because oftentimes when we find just this amazing connection with somebody, now we just want to jump in and be with them all the time, every day, and that can feel emotionally overwhelming. Have you ever had that?
I actually was literally just telling Mackie about this.
Okay.
Tony's other daughter. Literally like an hour ago, that I had a boyfriend in high school, and super, super sweet guy. We had been friends for years before, but one day I was doing a test. It was a final.
Okay.
And I had texted him and said like, hey, I've got to do this test. Like, kind of like, don't bother me. I don't remember. This was like 12 years ago or something, but, and he started saying, I feel like you're upset though. Like, can we talk? And I was just like, I have to do my test. I literally still feel the anxiety, like, of what I felt. I was literally going like, please just stop. Like, stop. I can't do it. And I was just like, please just give me a moment. And like, I'm not mad. I just need to finish my test. It's timed and it's a final and whatever. And then he called.
Oh man.
And I'm like, please, like, just like give me a minute. Now you're frustrating me.
Yep.
And then I hung up, whatever. I turned my phone off. Then my mom gets a call. No, it was my house phone first.
Wow.
Then my mom. So house phone first, then my mom. That's 4 things. And my mom talked him down, I believe. Like, I don't remember details, but then Him and his mother showed up at my house.
Oh.
Yes.
Okay, that is.
I thought he was a great guy. He really was. But I don't know if this is a specific type of person, but once someone comes on too strong, I'm like, I'm done. I don't actually like you anymore. Like, I'm done. It's like a turn off, whatever you want to call it.
Yeah.
So, yes, it's happened to me. And I don't know if that's happened to you, Nims, if that's what you feel.
Well, Nims even jumped in there and said, I am anxiously attached.
Okay, yeah.
Yeah. So that's like,
unfortunately for him, I literally cut it off for that reason. And he's a great guy, but I couldn't deal with that. So maybe it's just not a good match. But
well, it's a good point though, because this is where we kind of go after. The pants.
They're from Go Gal.
Go Gal.
He looked at the tag for me. It's like, I think it was like the pink tag. Go Gal. I don't know what that is either, to be honest. I'm gonna look it up.
Okay. But what I like about so if you are aware of your anxious attachment, that now we go back to what I almost feel like the theme of tonight has been, other than birth, has been what do we do with our discomfort?
Yeah,
because
we
now
love it.
I have to be able to sit with that discomfort of wanting to go check. And I've done a couple episodes on Virtual Couch. Go find I think the dance of the anxious and the avoidant attachment. And on that one, I talk about the anxious is the one that I say you're allowed one time to check in and say, is everything okay? But then 5 minutes later, if she's not jumping up and down and singing your praises, you can't say, are you sure? Because I kind of feel like something's off here. You have to go pet a dog or do some push-ups or something.
Sit on your hands and just
be
with yourself.
Meditate.
Yes, meditate. Yeah. That's a great.
Yeah, exactly.
Anything except for don't text her.
Okay, in Southern Ashes, I saw this in thoughts on blocking exes on everything. I have thoughts.
Yeah, what are your thoughts?
Do it.
Yeah, it is one of the most, and I've only had, honestly, Southern Ashes, I've only had a couple of people do it, and I've been a therapist a long time. And then it is difficult because they feel like they're doing something wrong. They feel like, what if he needs something? What if, all those things? But then
what if he needs something?
I know, right?
What does he need?
But then it's like, but it gives that person, it alleviates over. I mean, at first it is uncomfortable, but that is an exercise in growing through discomfort, because you start to recognize that I don't have to manage his emotions or her emotions, and I can just start to be, and then you're going to have less of a trauma bond. We talk about often the intermittent. Do you know like the concept of the trauma bond?
I mean,
it's so
I've heard a lot about it.
Right. Intermittent reinforcement, like the person that gives you the punishment also delivers the reward, and so it just is this push and pull in the relationship. Yeah,
I have so many questions later.
Okay.
My problem is if I don't block them, then I'm waiting for them to call every single second of the day.
Yeah.
And it's like I can't get over it until I just block them. And it's like, I don't care if you call me. I don't care because I don't have anything else to say. And like, of course, this is with like a toxic relationship.
For
obviously, if you're like friends with your ex, I can't really tell me about that.
Wow, it's so cool for you.
It's really great and helped you. But obviously, if you're not, block.
Okay, the pink dress is gorgeous. I think that's you.
Thank you.
Yeah, Nims, thank you for asking. Okay, you have to go to Switzerland tomorrow or something, right?
Yeah, I have to pack my bag.
Okay, so we should call it a night. It's been an hour and 40 minutes.
Good job, you guys. Wow.
It went by so fast. Thank you so much.
It was so fun. I'll need to come into town again.
Okay. Seriously, you have to.
Yeah. Oh, go follow The Good Birth.
Yes, The Good Birth.
Yeah, and then Sydney will put this, or maybe at some point we'll get this up on YouTube with the chapters.
Yeah, and we changed your Instagram name.
It's Virtual
Couch now.
Yeah,
what was it?
It was Tony Overbay _LNFT or whatever. So we're Virtual Couch brand.
It's not confusing them along anymore.
Yeah. So thank you so much. Oh wait, she wasn't calling toward the end second time around. So okay, Southern Ashes.
Wait, we need closure.
Yeah, hang on. Southern Ashes. Hold on now. Hold on. Wait, is Tony still allergic? Chandler Schroeder? No, I like avocados. They're one of my favorite things ever. Chandler, it's good to see you. Yes, it is. That's very important. I used to think I used to be allergic to avocados and coconut.
You actually used to be allergic to them? Or
I don't know now.
Okay, you made yourself believe that.
I now eat them every single day. Chandler, give us those roses. That's right. Come on, Chandler. That's that was worth more than 6. I don't even know. Yeah. Okay, Southern Ashes. Okay, I see. Thank you for sharing. This isn't talked about enough, but it's good to know when there's Chandler. Go with those roses. Ask for help. Yeah. Let's see. Is saying your own. Is saying your own piece important? Oh, that's different.
To me, yes. Tell me why, Tony.
Okay. All right. One more. Okay.
There's also this one though.
Ruben says they look alike. You and I do.
Amazing.
Okay. Okay. What was the question again? It was, do I speak my piece?
Yeah.
This one, I'll go so fast. So in working with the world of the emotionally immature or the narcissistic person or person with narcissistic traits and tendencies, I got these 5 rules. Okay. And one is like when you're interacting with them, you have to raise your emotional baseline, self-care. Self-care is not selfish because you got to be in a good spot to be able to interact with this person.
Yeah.
You got to get your PhD in gaslighting, know that you're not crazy.
Okay.
You got to get out of unproductive conversations, learn to set healthy boundaries and know the difference between I'm going to pay your mortgage and roses. Thank you, Chandler. But then set healthy boundaries, but know that a boundary is going to be a challenge from the narcissist or the emotionally immature. And so we talk about boundary versus ultimatum. An ultimatum is you need to knock it off. A boundary is if you do this, I will leave. But then the last one is like, you'll never give that person the aha moment or the epiphany. Now I lay all that out because the question was, do you speak your mind or whatever? Mm-hmm. So it's not, because you're trying to give that person the aha moment or the epiphany. But once you recognize that I am not trying to convince, coerce, manipulate, or change that person, now I'm just expressing myself for my own integrity. But I have to be in a position where I know that I'm okay with invalidation. I'm okay with them even saying meaner things. And so then you have to really check in and say, so do I really need to say my piece? I mean, if it's an exercise in integrity, then that's one thing. If it's like, no, I really do want them to understand how bad they were, they're not. They're not going to get it.
What about, this goes with it. Sorry. We were like, we're going to leave. And we were like, ha, jokes.
You fit right in here.
Yeah.
Oh, Beck's Garage. What's going on?
So what if like years late, like I have an issue with 10 years later feeling like extreme guilt for how I left someone. Like not that I even care to have a relationship or anything, but that I wish I could like meet up with them again and be like, hey, I'm sorry that I may have made you feel whatever. You know, I'm thinking of a few different, usually they're people I broke up with that I would never talk to again. You know what I mean?
Yeah.
But I'm like, oh, I'm sorry that I broke up with you for this reason, and like you're still a good person kind of thing. And I obviously never will, but I sometimes feel like I hope it didn't like hurt them like that badly. I hope that they were just like whatever, you know.
Well, I like what you said earlier about we think that people think about us probably more than they really do. And
totally.
So a lot of times if you were in my office or doing a little therapy on that, I would want to like break down the game film of what's going on in your life at that moment when you start to think about that. Because then that would be, so when you really start to like listen to your feelings, because so often we stuff our feelings. So when we get a little older, we'll start to allow our feelings to come out. And so when they come out and you really start looking at, okay, where do I feel this? I feel it in my chest. I feel it in my throat. I feel it in my head. How big is it? Whatever. So, and then what, right? Chakras, right? And then what does that bring up for me? Then a lot of times it's like, if we're going through something now, and we let those emotions out, then it's going to cause us to have memories or feelings around things that we did when we were more immature. And so it's kind of bringing it up. And so I think it's almost is more powerful to be able to know that this is like, thank you body, thank you emotions for bringing this awareness to me. But I often don't think it's about the thing 10 years ago, but it's like that memory that your feeling has, or Because
oftentimes I feel it when I think about or am told something like that, I'm too sassy or too mean, I then immediately go to like, I did make my exes feel sad about XYZ. So then I'm like, yes, they're right. I'm mean because of this. You know what I mean? Which isn't I mean, it's not that I stew over it, but sometimes I'm like, oh man, I wish I could go back and just be like, that wasn't about you. It just wasn't a good fit.
And that's where, I do. And that's where, and I get a lot of feedback on the Waking Up to Narcissism podcast. And one of them are people saying, wait, am I the narcissist? And I always say, if you're even asking yourself that, you're not. Because you're curious about it. But oftentimes I do kind of think that I wonder if that just goes back to the, I'm starting to really recognize who I am. And so now I need other people to know who I am. And that is that reflected self. I need validation. And I just need to know that I now know who I am.
Interesting.
Because if you go try to interact with that person, there's a chance that you're going to go back and hand them this power. And then they're going to push your buttons.
For sure. Yeah. Ooh, yeah.
Look at what Kinsmat said a nice thing to you, by the way.
Kinsmat,
I'm going to cry. Thank you, pink dress girl, for saying that.
They probably are.
Exes, sorry about how many was.
Positive thought is that they probably are. Just assume they are. Who cares if they are?
I was going to say, in the world of emotionally immature narcissistic discard, they're not.
They're not. But also, you'll live a better life if you assume that they're so sorry for how they treated you. And granted, I don't feel like I was mean, but even, I don't know, I could go on and on about it, but it's just like, I don't want them to feel like negative about their life not that their whole life is about me, but like when they look back on their past relationships, I don't want them to be like, oh, and she broke up with me because I wasn't good enough.
Okay,
Then I get like, that's not why. Like it was whatever.
The good news is that most all emotionally immature people are like, you're the one that.
Oh, amazing! They're like, she was stupid.
Yeah, exactly. Right. So then you're like, okay,
I would rather that. It's fine.
Exactly.
We all have that ex that we will still do whatever for him, or am I stupid? You're not stupid.
Bex talks to their car. So
Bex is bad.
Right.
I remember you.
What do you mean by that?
No, do we all have an ex that we still do whatever for him? There is like a.
Here's a therapist. It's a great person to talk to. Yes.
Well, did you?
Yes,
how old are you guys? Like with do you watch the Twilight movies or whatever back in the day? The werewolf.
18 times.
Oh yeah.
Okay, so that concept of the imprint, there's a like a low key belief, as maybe the kids would say, about that once your earlier relationships almost leave like this imprint, and so then that would be you still have this ex that you think, because they're like in this concept called your relational frame of your first relationship.
Yeah.
So then you think that it was this thing that
it feels better because it was when you were innocent. It's like before you knew like how
life was,
crappy a relationship could be.
Oh my gosh.
Yeah, okay. All right. Hey everybody, thanks so much for joining us. Thank you for coming.
Thank you.
It was a great time. We'll see you next time you're in our land.
Yes, when I come to visit.
Okay.
Yes.
Okay. All right. Bye, everybody.
Bye-bye.
Have a great
Bye.
night. Let's see if I hit that. Nope, missed it. Got it.
You got it.
Got it. And that.
Our
10,000. Okay. And then we go over here, and no one is over here. So we in the stream.
You do.
Yeah.
That was so